Okay, so now what we're doing is we're going to work on body contouring. Okay, this is an excellent opportunity for a woman like her to really reestablish her shape. So everybody's looking for an hourglass figure, and how do you obtain that? Well, really, you do that by first doing liposuction of the entire flank. It's important to get up as high as you can into the axilla and all across the waistline. So if you take a look at that, you're going to see how I'm marking her for liposuction, and we're going to be doing a tummy tuck at the same time. I think it's critically important that when you do tummy tucks that you include liposuction of the waist to improve overall body shape. Up here, what I'm marking is I'm going to be doing liposuction as well of the upper abdomen, and that makes a huge difference in the result, okay? Because you're trying to cause as much flattening as you can of the upper abdomen and of the entire waistline. Now the patient has to help us, and what she's going to do is that she's going to grab all of this extra skin. Yes, and she's going to pull as tight as she can. I'm going to ask her to re-grab. And the tighter she pulls, the lower the incision is going to go. And I think this is a big mistake that surgeons make in general. They are always concerned about, making a low bikini incision, but they don't ask the patients to pull their skin tightly. And that is critically important when you're doing the marking for the tummy tuck. If you don't pull that skin up, then the incision ends up way higher than it needs to be. And now this is just a roadmap for me. This is just, a map when I'm in surgery to figure out, my anatomy here when I'm working. And the incision or the length of this blue line does not mean that that's how long the scar is going to be. On the contrary, all it means is that it's a guide for me to figure out exactly where I need to work. So now, again, we're working on symmetry, so I'm going to mark her at 10 centimeter intervals to make sure that we have excellent symmetry. And she is still holding on and still giving me tension here. She's being a great patient, super helpful. She's being really kind enough to allow us to do this video for a lot of women out there who are really interested in doing something like this, but they may be a little nervous, and that's totally natural to be nervous. That's part of the process. But the point here at Zuri Plastic Surgery is that we try really hard to help the patients feel comfortable and to feel empowered and to feel that they are in a very safe environment where we definitely have their safety as a patient in mind and as a top priority for us. So that is exactly what we're doing with her. We're just marking out everything and trying to get her the best symmetry possible. So again, these are just guidelines. These are not how far the incision is going to go. And the length of the incision is not really dependent on me. It's depending on the patient. How much extra skin do they have? So if she lets go, we're going to assess in surgery how much extra she has laterally out to here. And what we don't want to leave is what's called a dog ear. And a dog ear is a deformity where you stop the incision too short and you leave the patient with all of this extra on the sides. And that is not okay. Dog ears are not okay. Dog ears are caused really because the surgeon doesn't go far enough to take out the extra skin. Now the patient has to understand that that is part of the process of a tummy tuck. If we try to make mini tummy tuck incisions, patients end up very unhappy because they have a lot of extra skin laterally on the sides. And that doesn't go away by itself, and it doesn't go away with diet or exercise. It has to be removed. All right, so these are the markings. Remember, we're doing a plication here. We're going to do a muscle repair all the way down the midline to bring her belly as flat as we can. And it's going to give her a fantastic result.